Hi, welcome to Healthwise Alternatives. I'm your host, Jackie Bell. Today we have Dr. Christine Soley with us. Today we're going to talk a bit about the cholesterol myth. And so that's a topic that really I think that many people just don't understand. We're given a lot of wrong information. And if you could just explain the myth to us and maybe your holistic approach to solving that problem for many people.
Well, actually, the cholesterol myth, maybe I should give you a little background about how I actually got to it, even thinking about the cholesterol myth. My training was very, very conventional, as is every physician here in the United States. The medical school is essentially teaches you a Newtonian approach to medicine, which is a reductionistic, reducing everything to two things, cause and effect. And I had been practicing cardiology and doing relatively conventional cardiology after I first was trained. And then it occurred to me that I would send patients for cardiac cath or for bypass surgery or for angioplasty. And they would come back and the same vessel would be closed off or a different vessel would be closed off. And it occurred to me that this wasn't very much progress. Now, we had been taught in medical school that coronary artery disease was relentlessly progressive. There was no way to get rid of it. That it was permanent. Once you got it, it would eventually, if you didn't die of something else, you would die of that. And even though Pritikin, and a lot of people know about Pritikin had coronary artery disease in his lifetime and was really essentially told to pursue a sedentary lifestyle or he would die. And he didn't buy into it. He said he didn't believe plaque couldn't go away. Plaque, the part that narrows the blood vessel. And he believed that if you changed your diet and you exercised and you learned to relax, that the plaque would go away, and that's what he did. So he ignored his physicians and said that he was going to approach it differently. And he specified that at his death, the autopsy would be done, and it was, and his coronaries were clean.
Wow.
Now, you would think that science would say, this is wonderful, this is good news, plaque will go away. But they didn't. And they said, no, that's just a fluke. Plaque does not go away. We don't know what was the circumstances for Mr. Pritikin, but plaque will not go away. Dean Ornish came around and he said, no, Pritikin was right and I'm going to prove it. And he was the one who really demonstrated that you could get plaque to go away. Now, this was fortunate for me because I was in practice then and looking to do things differently. And at that point, I realized that if I didn't change my thinking from what I was trained in medical school, that I wasn't going to make a difference. And it was at that point that I began looking at how to get coronary artery disease to go away. Well, obviously one of the big things was the cholesterol myth, because I got my MD degree in 1970, and I was a cardiologist by the mid-70s, so I was practicing cardiology. And that's about when the statin drugs appeared. Now, when I was in medical school and in my training, cholesterol was not considered to be elevated unless it was over 350. Now, for people who are used to 200 or even less, that must be astounding. But that's what we believed, and we did not have anything easy that we could use to treat high cholesterol. We had immediate release niacin, which caused flushing. Patients didn't like it. And we had resins, which caused a lot of bloating and gas that would absorb cholesterol in the GI tract. And patients didn't like either medication. They were very time intensive. You would start a patient on a very low dose of niacin and they would flush. And after about 2 weeks, the flushing would go away where you'd raise the dose. And then they'd flush again. And they would flush for 2 weeks and would go away and you'd raise the dose. And so you'd start them at 100 milligrams and you'd have to work up to 3,000. And so obviously patients were very unhappy. And a lot of them simply wouldn't do it. And physicians weren't too happy either because it was time intensive.
Right.
Then the statin drugs came out. And you could give a pill, a statin pill, would lower cholesterol. There were no immediate side effects, no flushing, no GI symptoms, and cholesterol would come down. And then as they followed along, they would see, these patients, heart disease drop. And so this is a reductionistic science. Everything is reduced to two things. Cholesterol drops, heart attacks drop. Therefore, high cholesterol causes heart attacks. Well, of course, the makers of statin drugs want you to keep believing that. And they will do everything in their power to keep you believing that. But it just isn't true. Science fortunately marched forward, and what we found was that the statin drugs did lower cholesterol, but that wasn't how it worked. There was no good correlation between your cholesterol level and whether you're going to have a heart attack or stroke. The correlation was with inflammation. That when you have plaque that forms in your artery that narrows the vessel, that occurs because the lipids get into the wall of the artery. Your body knows that lipids aren't supposed to be in the wall, and so it sets up a reaction trying to get rid of it. And so this plaque in your artery now has a little fire in it trying to get rid of it. It's not successful getting rid of it, but now you have inflammation. The statin drugs are potent anti-inflammatory drugs, and they get rid of inflammation. They are not safe drugs, but they are potent anti-inflammatory drugs. The problem with using cholesterol as a guide to how much statin drug to give is because we don't have a way of measuring how much inflammation there is in the plaque. People have heard of C-reactive protein, and C-reactive protein is actually a non-specific inflammatory agent. Our bodies have been making C-reactive protein since man first existed. In fact, it's a survival technique. That it's the liver that makes C-reactive protein primarily, and the liver will make C-reactive protein anytime there's inflammation in the body. It doesn't matter if it's in your plaque or in your joints, or you have a virus and you have a respiratory infection. It doesn't matter where the inflammation is, your body will make C-reactive protein. Now, it may not seem logical to us why we would want more inflammation if we have inflammation, but from caveman days, the way people died when they were cavemen, if they didn't die by the saber-toothed tiger eating them, or falling off a cliff, or bumped off by another clan member, they died of infection. And so the body will evolve techniques that will protect it. And so if you're a caveman and you get a bacterial infection, now your white blood cells recognize it, and now you're having a reaction and you're trying to kill this bacteria, your liver says, here, let me help, and puts out C-reactive protein, which goes and helps the battle. So now you have two ways of fighting the infection. You kill the bacteria, the person survives. And so this gene has become now permanently embedded in our gene pool. And the only way you get rid of a gene in the gene pool is if you die before you reproduce. Well, we're not going to die from making C-reactive protein before we reproduce, so we make C-reactive protein in response to any inflammation. And we don't much die of bacterial infections anymore. And so it's not necessarily a particularly useful gene, but it is a way that we can measure whether there's inflammation in the body. Unfortunately, if we measure C-reactive protein, we're not just measuring what's the inflammation in the plaque. We're measuring inflammation, and any number of things can cause inflammation. I mean, arthritis, a virus, but just being obese, just being overweight is an inflammatory condition. Our fat cells actually produce inflammatory compounds which keep this fire going, and so will keep the C-reactive protein being produced. So the issue of C-reactive protein is that it's useful in telling you that you have inflammation, but it doesn't tell you where.
Right.
So, in fact, people may have heard recently, it's been in the media, that they're using statin drugs now for anybody who has an elevated C-reactive protein, whether their cholesterol is elevated or not. And little by little, very slowly, scientists and physicians are coming around to letting go of the cholesterol myth that it's the cholesterol that causes the problem. And little by little, they're embracing the concept of inflammation, because it is relatively irrelevant how much cholesterol you have in the plaque. If there's no inflammation, the plaque doesn't rupture. It's the inflammation that makes it rupture, and that's what causes the heart attack. So that's the myth, is that it's cholesterol, when in fact it's inflammation.